Good day and welcome to today's Dr. Anyoha's podcast. Today I am going to talk about cradle cap. I will start by saying that a lot of parents whose babies have cradle cap don't even mention it when they come for routine visits in my office. What happens is that I will notice the cradle cap, and since parents don't say anything about it, I just assume that either that they know everything there is to know and that they are already doing the best they can do, or that they know that nothing is worth stressing over and that is a benign condition that will resolve with time. Sometimes when the parents don't raise issues about it, I don't raise issues about it, and everybody goes home and I see the baby again. And perhaps by the time the baby comes back, cradle cap has gone away. So that is basically the story of cradle cap. It resolves with time, and most parents often don't stuff or know what to do with cradle cap. This is just tell you how common cradle cap is in pediatric offices, how comfortable parents feel about managing cradle cap. But for the few parents that bring it up or talk about it, I will engage them as to the probable cause of cradle cap and what they should do about it, how to manage it and treat it until it goes away. So let's begin by talking about the cause. To date, there's no definitive cause of cradle cap. This podcast, I don't want to go into the depth of the theories, etiology, or the cause of cradle cap. So what should parents do when they suspect or when they notice that babies have cradle cap? Well, let's start by saying what a cradle cap looks like. A cradle cap, when a baby has cradle cap, usually when they're about 3 weeks, they can have it at 3 weeks, they can have it at 4 weeks, 6 weeks, 2 months, you can show about 6 months. It doesn't matter. When a baby has cradle cap, they have some scaly, crusty lesions or rashes on their scalp. It could be on one part of the scalp. It could be on the frontal part of the scalp, near the forehead. It could be on the soft spots area of the head. It could be all over the head, all over the scalp. It depends on the particular baby and the severity of the cradle cap. So it can range from mild cradle cap involving parts of the scalp or the head, or it could be severe and extensive. And of course, the parents are rightly upset because this is a brand new baby, 3 weeks old baby, and they don't want anything to happen to this baby because the baby was just born and the baby was supposed to be perfect, and suddenly they have this cradle cap on the baby's scalp. So parents are usually upset, and we'll talk about it. So the scalp lesions, like I said, they can be on one side of the scalp, they can be all over the scalp, and they can come in different sizes. The scales could be greasy, they could be yellow in color, they could be weepy, they could be dry, scaly rash, they could be weepy, scaly rash all over the head. And the parents already know that this is cradle cap. Also, there are areas of hair loss, or the hair is not growing where the cradle cap is, because the cradle cap is suffocating the hair from growing. So it's one of the things that upsets parents. And of course, in some kids that have dark skin, it's very hard, or it's harder to discern cradle cap, but they're there and the parents will point them out to you if they're very concerned. They will point out to you and tell you that my baby has cradle cap, what do I do about it? Even though sometimes they're doing a lot of things already. And some even trying home remedies. There are a lot of home remedies out there for cradle cap. But what, as a physician, as a pediatrician, I recommend is to use mineral oil or baby oil or petroleum jelly to moisten or to loosen up the scales, to make them soft and peelable. So the parents can comb out the scaly rashes one at a time with a fine comb or a soft toothbrush. For example, if mineral oil is what they have, the parent could put some drops of mineral oil on a baby's scalp and let it stay for hours, and thereafter wash it off thoroughly with water, after which they should start combing out the scaly scalp lesions. It could be painstaking for parents who want to do this. It could be painstaking. They have to do it every day, one at a time, until the cradle cap goes away. Some might come up the next day as you comb it off. Others might repopulate, and keep working on it until it's a daily thing. Parents have to keep doing it, combing off the scales as they're loosened up by applications of mineral oil or petroleum jelly or baby oil. This is a daily thing parents could do. Another thing they could do is to get baby shampoo. They could wash the baby's scalp with the shampoo. The shampoo loosens up the scaly rashes, the crusty scaly rashes. And again, the parents could use fine comb to comb the scales, the crusts out, taking precautions not to force the scales out, because if a scale or crust is not ready to come out, forcing it out would create some abrasion, some skin abrasion underneath, and that could cause more trouble. So leave the ones that don't want to come out, and you can revisit them the next day. And it's a daily thing until this condition resolves. So there's nothing extraordinary about treating cradle cap, and I want parents who listen to this podcast to be comfortable, to be able to apply these remedies of using mineral oil, petroleum jelly, or baby oil to soften the scalp rashes. And after waiting for a couple of hours, or even the next day, to wash off whatever oil you used, and then comb the scales out. And obviously the parents have to keep repeating this until they're comfortable this cradle cap is gone for good. Now, there are occasions where hydrocortisone cream is indicated, especially when the cradle cap is extensive and weepy. Okay, it's extensive and weepy, and hydrocortisone cream can be recommended. In those cases, moms, dads, and parents should seek out the opinion of their pediatrician to actually say it is okay for them to apply hydrocortisone cream. Okay, the most important is for an extensive cradle cap, parents should always check with their pediatrician if they are concerned and are interested in using hydrocortisone cream, because you just don't want to miss that something else could be responsible for the cradle cap, because there are a few more things that could look like cradle cap that is not cradle cap. So when in doubt, always check out with your child's or baby's pediatrician about cradle cap. So to wrap it up, cradle cap is a benign pediatric or baby infant condition. A lot of babies do have cradle cap. Sometimes the parents already know what to do and they're not asking questions. Other times the parents don't know what to do, or they're asking questions because the cradle cap is severe or is not going away as soon as the parents want. And today's podcast is to understand the strategies in managing cradle cap, which is number one, to know that it is a benign condition. Number two, to know that application of mineral oil or baby oil or petroleum jelly is what helps to soften and loosen up the lesions, the scales, as they attach to the scalp. which should be followed by thorough rinsing and wash and attempt to comb the scales out. Usually this treatment is repeated daily until the condition resolves. When cradle cap is persistent or severe, parents should always seek out the expert opinion of a clinician. Or when parents are concerned, parents should always seek out the opinion of a clinician or a pediatrician for that matter, so that they can get to the bottom of it. Thank you. As always, please share this podcast with your friends, your contacts, especially those that have babies and infants that might have cradle cap and are looking for expert opinion on how to manage their baby's cradle cap. Thank you.